Hi, my name is Swathi. I would be presenting the cumulative marketing proposal and educational presentation for the topic health in social media. My primary topic I have chosen is cardiovascular disease prevention. Target population 1 would be more than 65 years old, and the secondary target population includes 30 to 55 years old people. My focus is on importance of physical activity and balanced diet in prevention of cardiovascular diseases. As we know, CVD is a global phenomenon, and in the current magnitude, there is an increase in incidence and prevalence in developing world and newly industrialized nations. As estimated, 17.9 million people died from CVDs in 2021, representing 32% of all global deaths. Of these deaths, 85% were due to heart attack and stroke. 1% dies every 34 seconds in US from CVD. The most important behavioral risk factors of heart disease and stroke are unhealthy diet, physical inactivity, tobacco use, and harmful use of alcohol. The effects of behavioral factors may show up in individuals as raised blood pressure, raised blood glucose, raised blood lipids, and overweight and obesity. The communication strategies. Heart disease risk can be reduced through modifiable lifestyle behaviors, including diet, physical activity, alcohol consumption, and smoking. Strategies that comprise successful comprehensive tobacco control programs include mass media campaigns, higher tobacco prices, smoke free laws and policies, evidence based health school programs, and sustained community wide efforts. Self assessment and assessment by HCPs were two modes of cardiovascular assessment identified. Risk reduction and CVD prevention should cover multiple risk factors and occur on an ongoing basis to encourage adherence and adapt to patient changes. Social media is a powerful tool for health professionals in cardiology. Effective heart disease communication is what to say and how to say it. The cardiovascular risk communication strategy, which has most significant impact on cardiovascular health behaviors and risk factors, is the imaging. Quantitative and qualitative studies into individuals' perceptions of cardiovascular imaging risk communication strategies would also help to identify the key components contributing to its benefits as a risk communication strategy. The interventions to increase access to healthcare services like lowering costs, improving insurance coverage, and increasing use of telehealth can help more people get the care they need. Strategies to make sure healthcare providers are aware of treatment guidelines and recommended services are also key to improving health. There is a wealth of government resources and websites for health information, whether you are researching a particular illness or condition, need to find insurance options, or want tips on healthy eating. Shared decision making should start with an assessment of patient priorities and their own perceived risk of heart diseases. Here is the social media platform specific content with LinkedIn for elderly population of 65 years old. And here is the backend proposal, advertising proposal for target population 1 and 2. And followed by LinkedIn for target population 1 and target population 2, then followed by Twitter, and I have the conclusions updated for each of every platform included. And the third platform I choose is Facebook here with the same target population 1 and 2 of 65 years old and 30 to 55 years old. Next is Instagram. The next one is TikTok. The fifth one is the YouTube. And the final one is conclusion. How do we summarize a marketing campaign proposal and reference section? As presented in the PowerPoint slide, I have backend ad proposals for all the platforms that I choose on social media. As health professionals, we play a pivotal role in supporting behavioral modification through effective heart disease communication. Cardiologists, HCPs, policymakers, patients, and their family members and friends are the heroes among us, battling, treating, and beating heart disease. Using the 7 C's of communication as a checklist for all of our communication, that is clear, concise, concrete, correct, coherent, complete, and courteous, the best communications we can use. Two of the targets directly focus on preventing and controlling the CVDs. One is the WHO and the other is the World Health Foundation. In summary, the three major components of prevention are societal and policy levels to address the upstream social determinants of health, like altering the tobacco, food, and activity environment. Development of comprehensive and integrated health systems that are based on the primary healthcare philosophy. Individual level prevention, primary, secondary, and tertiary prevention or acute management. The WHO is currently working on increasing the normative guidance available for management of acute coronary syndrome and stroke, which will provide guidance in these important areas. Two major approaches include public health or community-based strategies targeted at risk factors. They are relatively low cost but require extensive education programs, perhaps in addition to the regional and national measures. There is no global solution to the problem as we know. There's the only thing is to modify the behavioral risk factors and to go on with the healthy diet and take good rest. People living in low and middle economic countries often do not have benefit of primary healthcare programs for early detection and treatment of people with risk factors of CVDs. Throughout the year, World Health Foundation celebrates heart heroes by writing the unique stories of people and teams dedicated and commitment to providing cardiac health and reducing the cardiovascular disease. There is a lot of research going on regarding the prevention of cardiovascular health diseases. But globally, we know it's not an easy way, or do we have a complete solution for this? As long as the research goes on, as long as the communication strategy is followed in preventing the CVDs, which is a really good thing that can help prevent the CVDs in all the age groups. And thank you so much for giving me this opportunity to learn and present about the social media platforms in the health era.